hit it here and place it in the forehead right here. And I ask the patient, can you hear this in both ears? And she said yes. And is it loud in both ears? Can you hear it equally in both ears?
Yes.
So that's a normal response. If this was a positive Weber's test, bear in mind the conductive hearing loss, alright, there will be a problem. The ear that is affected will hear the sound the loudest. So if this was conductive hearing loss, the patient will tell me that she can hear the sound louder in the affected ear. And that's the ear with conductive hearing loss, alright? But that is absent here, so that would be a positive Weber's if it was louder in one ear, but it's louder equally, it's normal, it's heard equally in both ears, so it's a normal test. It's negative Weber's in this case. Thank you. Alright, so I'll move on now to cranial nerve 9, which is glossopharyngeal. The glossopharyngeal supplies the posterior 1/3 of the tongue, alright, as well as the pharynx. It also supplies the uvula as well. So I would like to perform a gag reflex. In this case, I want to ask the patient to put their fingers to the back of her mouth, or I want to depress the tongue with the spatula and initiate the gag reflex, which we would not do in this patient. Alright? Bear in mind, the gag reflex is normally the two cranial nerves that are responsible for gag reflex is cranial nerve 9 and cranial nerve 10. So mentioning that you like to do the gag reflex is enough in this case, and you'll be told to move on. Still on cranial nerve 9, alright? When you're eating or when you drink coffee, are you able to taste it at the back of your mouth?
Yes.
So taste sensation, the posterior 1/3 of the tongue is intact as well. Alright, so I'd just like you to open your mouth for me, and I'm going to shine this light in your mouth. Right, I'm going to put the tongue depressed, so just look at the uvula and say ah for me. Thank you, close it. So upon saying ah, there was no uvular deviation, the uvula was central. If the uvula was deviated, the uvula tends to deviate away from the side of the lesion. So if the uvula was deviated to the left, upon she saying ah, it means that the lesion is what? On the right. So you will suspect the right cranial nerve 9 palsy if the uvula deviates to the what? Left. Alright? That's 9. So now moving on now to 10, which is the vagus nerve. Alright? How are you feeling so far? You're feeling good. So the patient's speech is not broken and is not impaired. Bearing in mind that the vagus nerve supplies the vocal cord, there's no hoarseness, and her speech is normal. So it's safe to say that the cranial nerve 10 is fine. But just to still be sure, can you just swallow for me? Right? She also has no problem swallowing, so cranial nerve 10 is safe to say it's intact. Alright, so moving on to cranial nerve 11, the spinal accessory nerve. Bearing in mind that supplies the trapezius and the SCM muscle, synovial master muscle, so I want to check for their function. So just shrug your shoulders for me upward. And this will go behind you. I'm going to try to push it down. Don't let me push it down. Alright, you can put that down. Alright, that's good contraction there. Now just try to look to the left. Right, I'm going to try to push your face forward. Alright, don't let me push it forward. So I can see that the SCM muscle is contracting, it's out here, and I just palpate on the SCM, and the tone is quite good. Alright, thank you. We'll repeat that on the other side. Look to the side. Right, look as far to the right as you can. Don't let me push your face back here. And then I'm going to be palpating the SCM here. Alright. That's good. So much well. Alright, thanks for that. Alright. So now that's 11 done. Moving now towards 12. Alright. 12 is the hypoglossal nerve. And the hypoglossal nerve supplies the intrinsic muscles of the tongue. Alright, so it's for tongue movement. So I will do that by first getting the light. And tell the patient, open your mouth for me, please. And I shine the light inside, and I'm checking for any fasciculation in the tongue. Alright, it does fasciculation. It can also be suggestive of a lower motor neuron lesion. So I don't see no fasciculation. So now stick the tongue out for me. Alright, so the tongue has been sticked down, the tongue is central. Now you can bring the tongue out and move to the left and right. Alright, right, you can take it back in. So normally when the patient brought the tongue out, right, before moving left and right, if there was a lesion, upon bringing the tongue out, the tongue would naturally deviate to one side. Remember, the tongue always deviates to the side of the lesion. The uvula deviates opposite the side of the lesion. So if the tongue deviated to the left, the lesion is likely on the left. Alright, if the uvula deviates to the left, the lesion is on the right. Alright, so it's something to take note of. But in this case patient, the tongue was central and there was no deviation. At this point, you would say that you would like to end the examination by doing a full neuromuscular examination of both the upper limb and the lower limb. Alright? And you also like to thank the patient. Alright? Remember when we're doing the pupillary light reflex, we have to dim the light in the room. Alright? And before you do your ophthalmoscopy or fundoscopy exam, you'll probably want to put a dilator into the eyes. Alright? That to open up the pupils so you can be able to visualize the retina. When we're doing the visual acuity test, in order for the patient to look at this knowledge chart, she's going to have to close one eye and read the letters with one eye only, and then switch and close the other eyes. But anyway, this examination was normal. So, in summary, I saw Miss S, 22-year-old female who came in, for examination of her face, the nerves in her face. On general inspection, she was sitting at rest, no obvious physical distress. And basically, a sense of smell olfactory was normal. My examination of 3, 4, and 6 showed that extraocular movement was full and free with no impairment. Now my examination of cranial nerve 2, light reflex was normal. Her visual acuity was good with 20/20 vision. There was no evidence of diplopia, and basically eye examination was normal. Trigeminal examination was also normal with intact sensation of all the trigeminal branches. Also, when I did the facial nerve examination, there was no ptosis. Speaking of facial nerve examination, there was no ptosis. I forgot to do the close open eye test. There was no ptosis of the eyes. There was no drooling of the mouth. Facial nerve 7 was fine. Cranial nerve examination 8, Weber's was negative. Ryan's was also Ryan's test was also positive. And when I did cranial nerve 9, it was normal finding. Basically, my entire cranial nerve examination was normal. I couldn't appreciate any abnormality in this exam. And like I said, I would like to finish the examination by examining the upper and lower limb. Thank you. So stop there.